If you look on your tables, you've probably looked at the packets, and I just want to bring your attention to the biographies that are there so that we won't take a lot of your time making introductions verbally, but you can look at the more detailed material there. And just for a moment, I'd like to introduce a few people who are new to our community, relatively, in that they haven't been to this conference before, and new in their positions. Mike Albin, would you stand up? Mike, here's Mike, who's the president of Wolfson Hospital, who's come here from Tampa. Mike, welcome. And Jim O'Loughlin. Jim is the president and CEO of Memorial Hospital. Welcome, Jim. And Dennis Romine. There's Denny. Welcome, Denny, who's now, I think, the COO of St. Vincent Systems. And Kyle Sanders. Welcome, Kyle. And Kyle is the new successor to Denny, the CEO of St. Vincent Southside. And finally, and not last, of course, is Gail Schaefer, who's the CEO of the Naval Hospital. Welcome to all of you. You're an important part of our community. I bring these folks up for other reasons too, and that is that the issue that I mentioned earlier that CEOs and others identified as a top priority to discuss today was access to care, and in particular the access to care to our safety net hospitals. And in a sense, all of our hospitals are safety net hospitals. They see patients in the emergency room, whether they have low insurance or no insurance, whether they're criminal or illegal immigrant, they get care. And they usually get care from the same physicians and nurses and health professionals as others. But there's some of our system who are more vulnerable than others. And two of our institutions qualify by the IOM definition of safety net hospital, and that definition's in your packet as well. And one is the University of Florida, Shands Jacksonville, as I mentioned earlier, and the other is the Wolfson Children's Hospital. Now, Shands has had a long history of care for an underserved population, or underinsured. At the same time, they have grown very rapidly from the days that I mentioned to you in the early 70s when it was Duval Medical Center to a full affiliation with the University of Florida with full-time faculty, with large numbers of faculty, medical residents, and medical students. And you'll see those numbers in a fact sheet also in your packet. And you'll also see in that packet, and actually you've received it over the last 5 years, information regarding the biomedical research that is going on there and has continued to increase and is an important part of our economy locally. And of course, they're not the only ones who are doing this. Mayo and Wolfson and Nemours and St. Vincent's and these other institutions are doing research and involved in graduate medical education. But because of the Shands Jacksonville's particular demographic patient mix, because of the economy at the present time, the reduction of Medicare and Medicaid for patient care and also for graduate medical education, they're in a particularly vulnerable situation at the moment. And the consensus was that you should hear about this. Now, I'm so tempted, I cannot resist the excellent question that was brought up. Why aren't we doing more in our medical care, healthcare system for these preventive things to keep them out? But I'd like to ask a few of you, if you've got a certain relationship, how many people here pushed a lawnmower? How many people have pushed a lawnmower? How many people have pushed one without a motor in it? How many people remember a health food was what your mother said, eat or else? Anybody? How many people remember having nuts and fruit in your stockings at holidays or Christmas or other occasions? Anybody give those in your stockings or for holidays now? So there's been an enormous change. My grandmother was the best health care provider I've ever had, ever seen. Boy, when she rubbed your back, you felt wonderful. If you had a cough, you got a mustard plaster in your chest, you could hardly breathe, much less cough after that. But she stroked your back and you felt better. If it was springtime and you were not perky, why, you got a little dose of sulfur molasses. And next spring, you never acted not perky. When you had a wart on your hand or several warts, she'd say, go get a shiny dime. Got to be a new dime. And she would rub that dime over the wart and whisper a few things to the wart, and lo and behold, it went away. But she knew it would go away. She had no science to tell her it went away. It was common sense. If you were playing sports in the high school and they caught you smoking, and this is in the Bible, Bowel, and Tobacco Belt of North Carolina, you were kicked off the team. no question about it. You got caught. Somebody knew smoking was bad. It wasn't rocket science. So if we start putting all preventive things in the medical system, it'll cost you a fortune. We have to go back to those principles of what grandmother and mother say. When we were in school and we were misbehaving, we had the opportunity to duck walk around the room until we got cramps and we couldn't do it anymore. And then when the cramps went away, then you had to do it again. I mean, it was very clear what the repercussions were, and we've been derelict in bringing up our children not to do the kind of things that they should be doing. So, excuse me for promoting my grandmother. I wish I could bring her back. She had a lot of other things, like the meaning of work and how important that is to a healthy life, and the meaning of a merry heart. Take it from Proverbs: "A merry heart doeth good like a medicine, a dry spirit breaketh the soul." So there's just a lot of common sense that we don't need to do medicalization of. Now, for the medical things, though, we say, well, we're really that good, because when you look at the statistics out there, they'll say that we're 37th in the world in health. Well, how many people in the world believe that our medical care system is 37th in the world? Clearly not. And that's why things are so confusing. It's number one in cardiac outcomes. It's number one in cancer outcomes. So there are a lot of good things about our system, and we talk about the bad things. We've got to be sure that we don't throw out the good things when we're talking about the facts, unless we make those facts clear. And that's why it's important in these programs for the last 6 years, we talk about words that have meaning. We talk about patients, because a patient is a vulnerable individual. And these medical institutions then have a responsibility that goes far beyond my grandmother. She was caring, she was ethical, we knew that she had our interest at heart. But caring and ethics without science, without medical research, is simply well-intentioned kindness. It's not medical care. It's fraud if you call it medical care. So we have to remember that these institutions have responsibilities that are far beyond those of us who are just offering good advice. And so along with these other economic factors, they have the responsibility of keeping up with technology, the expenses of science, and the other things that make our bottom line complicated. Is it worth it? Should they be interested in science? Well, as we've just heard about the Human Genome Project, that investment by the National Institute of Health in the early 60s has resulted in something like $57 trillion of return on investment. Just the return on investment on cardiac research alone has been around 7 to 1. So the data is awfully good, and the thing that makes you be convinced is when you go around the world, other countries now, particularly China, India, Singapore, Taiwan, Korea, are very rapidly trying to capture as much biomedical technology and science expertise as possible for very good objective reasons. So after taking up a few minutes more than I should have, I'm going to bring the program of that's really of most interest and concern at the moment to the community, and that is our safety net hospital. We'll start with Mr. Tony Cavallo. Mr. Cavallo is from Tallahassee. He's the president of the Florida Safety Net Hospital Association. And when we asked if there was an outsider who was really an expert to come to our community, he was unquestionably the person that was felt to be invited. So, Mr. Cavallo, we appreciate your opening the program, and then we'll bring our other speakers to the program too.